Good morning, everyone. This is Lisa Myers with ARX Healthcare. I want to thank you all for joining us today. We have posted the slides on our website for today's presentation, and you can find those in the link in the GoToWebinar chat box. I have just a few announcements to make before we begin. Registration will be open shortly for our next webinar. This is not a bill, Does the Patient Financial Experience Matter?, which will take place on September 20th. You can visit tnhfma.org/webinars for more information. If you are in the Memphis area, please make plans to attend our first Lunch and Learn session, which will be co-sponsored with the Music City AHAM chapter next week, August 16th, from 11:30 a.m. to 1 p.m. The topic of discussion will be MACRA and bundled payments. Please visit the TNHFMA website for more information and to register. Also, please make sure you save the date for our Fall Institute, which is scheduled for October 19th through the 21st in Gatlinburg, Tennessee. We have a great lineup of speakers and topics that you will not want to miss, and more details will be available soon. Requirements to obtain CPE certificates today. You must be connected to the webinar for at least 90% of the duration, and you must respond to at least 2/3 of the polling questions. Our speaker today is Karen Freemoff. She has more than 13 years of experience in a broad range of revenue cycle positions. She is a certified revenue cycle representative with HFMA and is an expert in the areas of patient and consumer billing, payment processes and offerings, and patient communications. Prior to joining Care Payment, Karen served as a regional vice president at MDION. And Karen, at this point, I will turn it over to you.
Thank you so much. Thank you, everyone, for allowing me to participate and engage today and support the Tennessee chapter. This is actually my second time. I did a session a few years ago with the Consumerism in Healthcare as an MDION employee, and I'm certainly proud to be here today as a Care Payment employee, sharing with you a little bit more about the financial engagement strategies for the new healthcare consumer. A little bit more about myself. I'm actually right now in my home in Waterville, Ohio, which is outside of Toledo. I have a wonderful husband and twins that are 10 years old as of last week, and 2 soft-coated Wheaten Terriers that may say hello throughout this presentation. Thank you again for allowing me to be here today. We have a polling question.
All right, so I will launch that polling question so that everyone can respond. The question is, self-pay balances are a challenge to collect. Very much so, somewhat, or not at all. Right. Looks like we have about 94% voted.
Great.
I'll go ahead and close that. And the responses, you can see 79% say very much so, 21% say somewhat, and no one said not at all.
Great. Well, as the new generation of healthcare consumers enters the market and patients of all ages are being asked to pay more for medical expenses, expectations for a retail-like experience are becoming the norm. Price transparency, pricing, patient financing, patient technologies, and personalized service will influence patients' decisions, which providers to choose, and which treatments to pursue. In this shifting market, healthcare providers that transform their revenue cycle to meet the financial needs of their new healthcare consumers will have an edge in attracting new patients, boosting satisfaction and loyalty with current patients, and increased net volume and revenue. What some of the learning objectives today, we're going to talk about rising costs that are impacting providers and consumers, aka patients, satisfying balances with early conversations and engagement alternatives with a familiar keyword, for patients and consumers, demographic consideration of strategies to improve revenue cycle workflow and overall performance. You need to make sure that you're utilizing a best practice and making sure that you have a solution for every patient. And the C word, compliance. Making sure that compliance is easier by launching those conversations early and often to support the patient financial engagement conversation and to be compliant. The affordability gap is a barrier separating patients and providers due to the high out-of-pocket medical expenses and its difficulty in collecting them. However, one of the drivers of this issue is nothing to do with healthcare at all. Savings is the issue. We're a country that lives paycheck to paycheck. 50% of Americans cannot come up with $2,000 in 30 days, and that's reported with an income between $100,000 and $150,000. 40% of consumers have medical debt, with the majority owing $2,000 or more. 57% of all bankruptcies are due to medical debt. 1 in 3 Americans have no savings at all. Just 37% of Americans have enough savings to pay for a $5,000 or $1,000 emergency. And 56.3% of people have less than $1,000 in their checking and savings accounts combined. While most people are choosing high-deductible health plans on the insurance exchange or via their employers, this is becoming quite a problem. The biggest problem caused by this affordability gap is the fact that people are avoiding or delaying care, which means that you, the healthcare provider, can't fulfill your mission to service the needs of your community and manage population health. It also means that when people finally do go to the doctor, their condition may be worse, and that certainly becomes more of a costly expense to you. This is an interesting chart, so let's digest it for a minute. The top line shows the rise in deductibles over the last 5 years. Right below that are premiums. Wages have only gone up 10% in the same period, but have remained flat relative to inflation at 9%. Healthcare costs continue to outpace wages, so the affordability gap will just get wider. A trend that is closely related to the affordability gap is the rise in consumerism. The first 2 data points on this slide are from a survey that we did, Care Payment, conducted in 2015. 95% of patients surveyed say that it is important to know their upfront costs. 96% that were surveyed said it was important to understand their payment options in advance. As patients shoulder more financial responsibility, they place greater scrutiny on what they are going to receive. They start to expect the same service, convenience, and information about their financial aspect of what they're getting similarly to an Amazon, a Starbucks, or Gap. Also, we've found that in a consumer focus group, the only common denominator of how people want to access information or pay is that there is no common denominator. You truly need to have a plan for every patient. Demographic, sorry about that. Another huge trend are the generational changes in demographics. Millennials now represent the majority of the workforce, and they're the leading edge of many of the trends in consumerism. And they'll be the driving force in healthcare for the next 30 years. They want mobile apps, they want estimates, they are more likely to dispute a bill. And you see that 86% say it's very important to understand their payment option up front. That's from our patient survey. If you recall, I said earlier that 95% of patients surveyed said it was important to know their costs up front. That was those 2 top boxes, somewhat important and very important. This is only those who found it very important at 96%. Also, we discussed that an issue with people who are avoiding care due to cost. Millennials are more likely than anyone to avoid care due to cost. Yet another generational issue to keep in mind is our older population. They are consuming more healthcare services, and they, especially the retirees, have their own unique economic issue. The main one being that they're on fixed incomes, and they never took high out-of-pocket expenses into account when they planned their retirement. This group of retirees, just like the millennials, will be looking for a more flexible payment option They are looking for that plan for their situation at a provider. Retailization, easy for me to say, is really the response to consumer demands. As retailers enter the healthcare space, it's a strategy that encourages patients to act like consumers by giving them more choices in how they can care in their providing of their experience and what they're accustomed to in other aspects of their life. As you can see here, 82% of consumers are open to trying something new from a non-traditional way of seeking healthcare treatment. They're also very, very familiar with a payment plan similar to a consumer product of same as cash option at Best Buy. We have another polling question.
So our next polling question is, my organization is investigating or adopting retail approaches to serve our patients. Very much so, somewhat, not at all. Just a reminder, for those CPE certificates, you need to make sure that you're responding to at least 2/3 of the polling questions. About 68% of you that have voted, so we'll wait just a little longer. Okay, we'll go ahead and close that and share the results. So 19% say very much so, 73% somewhat, and 8% not at all.
Great. Good feedback. Well, you've probably seen a chart similar to this while you've been talking with other revenue cycle companies in the industry. However, I bet you've never seen a revenue cycle diagram that begins with promote and ends with nurture. Because patient out-of-pocket expenses are an increasing portion of hospital AR, it requires a new approach to handle these balances. Possibly in the past, a few statement cycles would produce a payment, or the debt would eventually go to a collection agency. But as that portion increases, this process won't work anymore. By adding a patient financing tool and giving an affordable option, a solution for every patient, you will improve your patient satisfaction and loyalty, as well as you will get paid faster. The first step is communicating with patients about their anticipated medical expense. It is an inevitable conversation that you're having these days that there will be an out-of-pocket expense. The times of your insurance will cover everything is gone, and there will be an expense, and most likely somewhat high. When helping your patients navigate through their options to determine the best plan to manage their out-of-pocket expense. As a result, providing proper communication and better financial experience for patients, you will capture loyalty and increase that patient satisfaction, as well as significantly impact your cash positioning. You will be assisting the reduction of care by those concerned by financial obligations. Communicate. We feel the best way to communicate is to make sure that financial options are visible and easily accessible throughout the patient experience. POS, conversations, brochures, on your website, marketing efforts, etc., early and often. This allows patients to fully engage up front and clarifies for both parties, you as well as the patient, the expectations surrounding that payment. Offering patients a peace of mind on how they're going to be able to pay and reducing the provider's work after self-pay determination. Navigating a conversation is going to maximize your benefits within the financial workflow. Clearly, when you validate the patient's identity, it is the first best step to effectively managing the patient's financial responsibility and ongoing communications. Your ability to collect is directly tied to your ability to get the right information up front. Evaluating the patient's options, making sure you've run through any type of screening, charity, asking them for cash, check, or charge, and then assisting them with a payment plan will be a component to reduce time to collect and bring efficiency to your process. By putting the patient in the right plan and the right payment amount, you are essentially assuring a predictable cash flow and will reduce rework and bad debt. Providing and confirming this payment plan will reassure you and get buy-in from that patient will also reduce confusion and reduces that likelihood of non-payment. Capture. So we started with promote and we're ending with nurture, which is within the capture category. Reinforcing the payment commitment received through the communication process requires active engagement of the patient through a variety of communication channels, a portal, a phone call, mail, etc. An effective follow-up and support process will maximize your dollars collected and will create returned customer as well as will be a consumer that will refer you. Capturing at access, capturing at the back end, getting their commitment, communicate an affordable payment plan, communicate that solution for them, nurture them and talk through what's going to be happening, communicate again on how they're going to pay, and give them all the ways in which they can make that payment. Again, one patient, you've seen one patient, you've only seen one patient. I have another polling question for you.
For our final polling question, our patients are satisfied with the billing process? Very much so, somewhat, not at all. And again, just a reminder for those of you that are wanting to obtain CPE certificates today, you'll need to make sure that you answer at least 2/3 of the polling questions. And this is our final question. Give you all just a little bit longer to vote before I close that question. And you can see the results there. 15% say very much so, 74% say somewhat, and 11% say not at all.
Okay, so we've got a trend here, either somewhat or high, and we've got a few that are doing really great. So good. All right, well, let's talk about improving customer and patient satisfaction. We, Care Payment, we did a survey in October of 2015, and we utilized Hardwick Research. They are a Seattle-based firm with over 20 years of history, and they've done surveys similarly to what they did for us for Starbucks, Expedia, financial institutions, and healthcare organizations. They did a random sample of 407 of our program participants, and the program participants represented different organizations across the country. The results within the survey were industry standard, above industry standard at 95% of confidence level. My intention here is to just share how important it is to work with providers that will assist in your AR performance, as well as work lockstep with you on your patient satisfactory and loyalty scores. Making sure that you utilize a partner and a solution that is continue to care for your mission and values within your organization and within your community. In addition to improving patient satisfaction, engaging patients more effectively upfront through the revenue cycle will yield more financial rewards. Here's a comparison of a status quo collections upfront versus a more flexible financing arrangement upfront. So there's one provider on the left that didn't offer any type of an extended payment plan option, and the other side that did. What you'll see is with the status quo, very generic statements, no urgency in getting patients the ability to pay, no due diligence or analytics for determining what the patient can pay, so you're not looking at any type of high or low propensity and doing a different financial impact or workflow on them. And there was just really an informal payment arrangement, which is very concerning because you could be then open to truth in lending regulations that you are not a parent with. At the beginning of the process, give your patients an option for a 0% financing option as your last alternative. And this will capture more people coming into the program that will then, again, improve patients' loyalty and satisfaction, reduce cancellations and delay of care, significantly impact your cash positioning, and assist you with the compliance concerns relative to a payment plan over 4 months. And I'll get into that in just a brief moment. Even if you don't capture revenue upfront, you are still have the opportunity to engage patients more effectively by giving them payment options later in the revenue cycle. Normally, we see a steep decline in collections at day 30. So we do our corporation, and a best practice would be to work with an organization that would do an analysis for you. How are you tracking and trending in your collection efforts? And our national presence, these assessments, about 60 days, starts to drop off substantially on the collection efforts in a pre-bad debt model. This diagram shows how you can improve net cash by offering financing later in the revenue cycle. Much like prior shifts in health, paradigm shifts in healthcare, this is a shift in the way that you need to think about financial performance. Fees may rise, but the true goal and the end result is increased net cash. It's a philosophical change in your communication and your nurturing of that pre-bad debt collection effort. Instead of a pressure payment of a second, third, fourth, or final letter, you're giving them a pleasurable conversation, thanking them for coming into your healthcare provider center, facility, etc. And you're offering them a payment plan on their $1,200 outstanding balance and showing them it's a simple $100 a month for 12 months. So in addition to your standard POS collection practices, you see in the top arrow, you can greatly augment your collection capabilities by engaging patients with more options throughout the revenue cycle, as it is at the bottom arrow. So best practice is to offer a patient financing comprehensive solution at access, have the patient raise their hand and ask for support, as well as assisting them with communication and ways and means in which they can take that high balance on the back end and manage it into a fixed payment plan for 12, 24, or 36 months. Again, this will significantly improve your cash performance, your AR metrics, your satisfaction and loyalty, repeat business, and referrals, as well as compliance. I realize no one here on the phone may be selling cars or tractors, but there's no secret that consumers are accustomed to getting information about the financial side of large purchases. As a rule, healthcare providers don't usually advertise price or payment options, but that gives providers that do address financial side of healthcare an edge over the competition and the ability to gain market share. I want to emphasize the market is shifting. Patients have a choice in healthcare, and as consumers, they are choosing providers based on cost of care and quality of care. Having a more retail-like strategy that includes financing and information about pricing is an essential tactic. We are seeing more providers looking at innovative ways to help patients meet their financial obligations, and they are doing that by extending payment options internally or through an early out collection vendor. However, as you become more consumer-focused, you'll have to be more aware and focused on the consumer protection laws as well. What's happening is that regulatory agencies and plaintiffs' lawyers are increasingly focused on issues related to these consumer accounts, disclosures, servicing, collection, and privacy. As Congress works to protect consumers from unfair credit practices, many medical facilities risk being caught in the crossfire. And many providers are unknowingly exposing themselves to increasing levels of regulation, risk, and potential penalty. Let's take a look at a few more regulations that you may be subject to. 501R. I'm sure that as a not-for-profit facility, you're very aware of the 501 2010 law that passed on the 501R on the rights and regulations of being able to extend outreach with reasonable efforts for those that need assistance in their payment options. What you need to know is that communicating early and often via websites and interactions is great. Embracing a tool such as a patient financing solution could be a great launching pad to that financial triaging conversations early on as well as in the back end, making sure that you screen, you check for all the eligibility as well as charity, asking for cash, check, or charge, and then providing a solution for every patient in a fair and reasonable way and effort is a best practice and certainly one that a patient financing strategy can comply with you with. It is painful, and it's a powerful way in which it's impacting patients and providers alike. It is inevitable that you are, again, having conversations with patients very, very early on about their insurance and what their deductible is and how much they need to pay before they can even get service done. So having those conversations early and nurturing and promoting conversations early and often is definitely a best practice. Patients are also expecting a retail-like service environment, offering them a conversation on how and what they're going to get for their service, as well as how and when they will need to pay, is a best practice. Providers should engage patients, promoting and nurturing, promoting and communicating, navigating and nurturing, capturing and communicating. These are all best practices and ways in which you will be able to significantly impact your AR performance and keep your patients satisfied and loyal. Stay compliant and leverage it as a launching pad for successful conversations with solutions that truly have a plan for every patient. My name is Karen Frema. I am the Regional Vice President at Care Payment, and it has certainly been my pleasure sharing this information with you today. Following this call, if anybody would be interested, I can certainly provide the chapter market-leading white papers, as well as links to various information on patient financing strategies, as well as information to support the care payment solution. Thank you for your time today.
Karen, thank you so much. We do have one question that was submitted via the chat box, if you would like to address that. How important is training of frontline staff in POS collections?
Oh my goodness. I would say the front-end conversations are the most impactful conversations to have as you are having a consumer or patient coming in. You're certainly triaging their health care, but then you also need to really be lockstep with triaging their financial the conversation as well. So validating their identity is going to be so important, as well as capturing their information relative to the insurance and how they're going to pay, and having that conversation as a financial advocate early and often is going to support success of that payment and any type of back-end collection effort. So I would say that if you are doing anything right now in the training environment of the financial workflow, spend most of that time at the access and conversation and trying to get those individuals to raise their hand if they need help early and often, so that the back-end work isn't so difficult.
Great, thank you. If anyone else has questions, you can submit those in the chat box below in your GoToWebinar chat box, and we can relay those to Karen. We'll wait just a moment and see if anyone else has questions they would like to submit. We have another question, Karen, that came through that says, do you offer this type of training?
We do. So our solution, I certainly don't want to, but I have the opportunity, so I'm going to take it. The Care Payment Solution does offer training at all elements and aspects of your financial workflow and those patient conversations. So that would be a best practice, looking at a patient financing solution to make sure that, one, they're able to significantly impact and train the appropriate individuals on the messaging and where it is to have the conversation relative to a patient financing. Again, my recommendation would be that a patient financing solution, such as what we talked about, is never your first out of mouth, it's your last. It's just the last toolkit to support those in need of managing a high balance over a length of time in an appropriate fixed income methodology.
Great. Looks like we have 2 more questions that have come in. Are you seeing more hospitals participating in offering outside financing options for patients?
Great question. So I've been with Care Payment since December of 2015. As you heard my bio, I was with MD Interchange Healthcare for 13 years, and I came over to Care Payment because it was such a unique conversation to have, to be able to support those that are in need of a payment plan and significantly impact the hospital's positioning of cash. So in my conversations over the last 8 months, it's been so amazing to me that I have had many of them basically say exactly that. We looked at this 18, 24 months ago, really didn't make sense, but we need it now. So it's definitely a market trend change, and it is a need in the marketplace to have something similar to this, to be able to provide a plan for every patient, but then not having to take the heavy lifting of supporting it, of compliance, the truth in lending laws, and all the state and federal regulations. So having a third-party partner come in to support something like this is definitely advantageous. 2014, our company had anywhere between 100 and 200 clients. We are now north of 750. So you can see definitely just with those numbers that the marketplace has shifted, and competitors around you are utilizing a tool such as this, and certainly want to keep those patients with you if they need a patient financing plan.
All right, and the last question we have submitted is, how should providers develop better care cost estimates?
We do not have, and that would be something that certainly can engage with any type of revenue cycle organization, but running propensity to pay is probably your best option. So you want to run eligibility, any type of the screening for charity, and then find a propensity to pay. Are they high or low propensity to pay? So then you can then have a financial workflow strategy on that individual patient of what goes next. Do you send it with a high propensity to pay to a similar like care payment solution, so that you're just giving them an option to pay over a term because there's a high balance? And if it's a low propensity to pay, is your best strategy then to go with a bad debt collection agency? So you can certainly be able to target and pinpoint the best strategy in a financial workflow of a patient as you look through the different screening and propensity to pay and predictability to pay and options of how you're offering payments in early conversations at access.
And looks like we've had another question come through. Do you participate in pricing transparency with hospitals?
We do not, but I can certainly find out who would be the best strategy for that, and I can give that to the chapter. I'll put that as a note.
Great, thank you. At this time, I'm not seeing any more questions come through, so Karen, thank you so much for presenting today, and thank you to everyone else for participating.
Thank you for having me.
Great, thanks Karen. At this time, we'll conclude our webinar.
Thank you.